Well, my name is Matthew Jose, and today I'm bringing you a video of the cardiovascular system. And today's video is going to be about the heart and the anatomy of it. And approximately, before we get into the things, we want to know. I'll just give you a few tips, things that you need to be aware of. Everyone's heart is approximately the size of your fist. Okay, so if you clench your fist together, and the shape if you look at the size of your fist at the current moment, that is how big your heart is. And it's not exactly entirely true for everyone, but in most cases this is how big your heart is. And the location of the heart is in the superior surface of the diaphragm, so it's just above your diaphragm, and it's on the left of the midline. So if you find the midline, so if you can find your sternum and then you find your diaphragm, the heart is on the left side of your chest, and it's anterior to the vertebral column and posterior to the sternum. So the vertebral column being your spine, the back, so it's anterior in front of that, but obviously it's behind the sternum, so posterior. So here on the screen you have a diagram of where the heart is located. So again, if you closely look at the mouse, you can see here is the diaphragm, this line here where my mouse is pointing to, and over here is the midline, and round about here, just next to the clavicles, here you got your sternum. So referring back, it is in front of the vertebral column, but it is behind the sternum. And what again you have here is the diaphragm. You've got the apex of the heart. You've got the left and right lung, and you have all the branches and the valves that come off it, which we'll go in a bit more detail. And there's a CT scan of what you're looking at. Now, the coverings of the heart is the main thing that you want to be aware of as a student, and these type of questions do often come up very often. So the first one is the pericardium. It's a double-walled sac around the heart composed of one superficial fibrous pericardium. So the pericardium is split into two things. It's got the superficial fibrous pericardium as well as a deep two-layer serous pericardium. The deep two-layer serous pericardium can then be split into the parietal layer as well as a visceral layer. So the parietal layer lines the internal surface of the fibrous pericardium, whereas the visceral is also known as the epicardium, lines the surface of the heart. And the fluid that's separated between them, it's known as the fluid-filled pericardial. And it's when infections like bacterial infections or viral infections get in this, you get pericarditis, which in terms of pathology, it can cause chest pains, various arrhythmias, and there are certain clinical signs and symptoms that you can look out for in terms of pericarditis. But the main thing you need to be aware of, it's a double-walled sac around the heart composed of a superficial fibrous pericardium and then a deep layer which contains of a parietal layer and a visceral layer. The function of why do you need a pericardium? So the pericardium, it protects and anchors the heart, prevents overfilling of the heart with blood. So there's a limit, that muscle, otherwise your muscle is going to tear apart and break in case there is no mechanism to prevent it from overfilling, and allows for the heart to work in a relatively friction-free environment. So that's what the fluid is there for. So here on the screen you have basically a simple diagram. Not sure if you guys can see it very clearly, but what you have here, where my mouse is pointing to, is known as the myocardium. Right, the myocardium is like the muscle of the heart. And this right here, it's known as the heart wall, and over here are the different layers. So you have the fibrous pericardium here, and you have the parietal layer here, and then you've got the visceral layer. So the visceral layer is the one that surrounds the top of the myocardium, and then you have an internal layer which is known as endocardium. So the coverings that you need to be aware of, so in terms of going from going from the superficial to the deep layer, so the first thing you have is a fibrous pericardium, then you have a parietal layer of serous pericardium, and then that swiggles around like this, and this bit is known as the visceral layer. So the cavity between the pericardial cavity lies between the visceral layer and the parietal layer. The visceral layer is directly in contact with the myocardium of the heart, and then beneath the myocardium, what you have is known as the endocardium, which is in contact with the muscles of the heart chamber. So most people suffer from infection or inflammation to this area here, pericardial cavity, which I was referring to a minute ago as pericarditis. You have chronic or different types of pericarditis. So the epicardium is a visceral layer of the serous pericardium, myocardium, cardiac muscle layer forming the bulk of the heart. There's a fibrous skeleton, which we'll go into, and so this is what you have on the screen now is what the heart wall consists of. So the epicardium. So the epicardium is also known as the if you go back, visceral layer or of the serous pericardium. So this is known as the epicardium. There's another way of saying it. So Americans usually refer it to as epicardium, whereas UK or European students probably refer it to as a visceral layer. It is here. You can see it's known as the epicardium. So the epicardium is the one directly in contact with the myocardium, and the endocardium is the one that's directly in contact with the heart chamber. So in a sense, the endocardium lines the inside of the heart. The epicardium lines just outside of the heart, and then you have a little gap or air sac where there's fluid, which is then lined over by the parietal layer of the pericardium, and then on top of that you have a fibrous pericardium. So in all together, if you were to try to remember this, you want to remember it as you have one layer on the very outside, a second layer, then an air sac, then another layer, and then another layer. So altogether, you should be aware that there's 4 layers. That's how I've learned it, and that it sticks in my head. So first one is fibrous pericardium. The second was also pericardium, but it's a serous parietal layer, or you can call it the parietal layer of serous pericardium. Then you have the visceral layer, or known as the epicardium, and then finally you have the endocardium. So external heart, major vessels of the heart. So vessels returning blood to the heart means blood from body to the heart. So these ones are veins because they carry deoxygenated blood. And there is the superior and inferior vena cava, and you have the right and left pulmonary veins. Now, so whatever veins, people generally define veins, or you've probably been taught in school by a teacher, or maybe by your ignorance or of reading a textbook or something. I only knew this when I got to university. I always used to confuse veins as something that only carries deoxygenated blood. So I remember it in my head as something that carries in a diagram, it has to be blue because it carries deoxygenated blood. But in fact, that is not the case at all. It's only the superior and inferior vena cava which drains the deoxygenated blood back to the heart, whereas right and left pulmonary veins actually bring oxygenated blood from the lungs to the heart. So when you're talking about veins, you should refer them to something as valves that transport blood back to the heart, and arteries as valves that transport blood away from the heart. Now, vessels conveying blood away from the heart include the pulmonary trunk, which obviously splits into right and left pulmonary arteries. So then they are the ones that go in away from the heart, and they go towards the lungs with deoxygenated blood. Then you have the different types, 3 branches from the ascending aorta, which are the brachiocephalic, and you have the left common carotid as well as the subclavian, which then branches off into various different arteries, such as radial artery in your arms, and various so on and so on. The left common carotid goes up towards your head and neck, whereas the brachiocephalic goes down towards the rest of the part of the body. So I've given you different ways. So external heart, vessels that supply drain the heart. So you have, not only do you have vessels blood vessels that drain the body and the cells and the different amenities and extremities of the body, you also need a source of artery and vein in order to drain the blood supply from the heart, because the heart is also one of the biggest muscles in your body. And the arteries that surround the heart are also known as coronary arteries, and the veins are known as coronary veins, which I haven't got on the screen. But the names of the coronary arteries include left and right left coronary arteries, or you can call them RAD or LAD. You got the marginal arteries, circumflex, and anterior interventricular arteries. Veins include small cardiac, anterior cardiac, and great cardiac veins. So here is an image on the screen of basically pretty much the heart from the anterior point of view, and we'll go through it in bit by bit. So here on the bottom you have the apex. So this is, you know, just about touching here, about just around here where my mouse is moving now is where the diaphragm is. You have your aorta, ascending aorta, coming off from the left ventricle, and you have your inferior vena cava as well as your superior vena cava, which drains blood from the body. So the superior vena cava drains blood from the head and neck, whereas the inferior vena cava drains blood from the rest of the body. And then on here you have the right atrium, and here you have the left atrium. These squiggly things are known as the auricle, and there are some fatty deposits on your heart, and people generally tend to refer it as a bad thing, but you do need some sort of fat percentage on your heart or on any type of organ, because fats do protect them from injury, movement, and it really anchors them and stuff. So don't 0% fat is not always good. You need some, but not too much. You have the pulmonary trunk here, which then divides into left pulmonary, and that one goes into right. So this one goes to the left lung, whereas this one probably goes to the right lung. You can see it coming around the back. You have the left pulmonary veins, and the right pulmonary veins over here. So these bring back oxygenated blood from the lungs to the heart. So the right pulmonary veins drains into the right atrium, which then goes down to the right ventricle, which is then pumped away through the pulmonary trunk, and via the two different valves. Same thing with the left hand side, but this time it's gone from the left atrium into the aorta, which then splits away into brachiocephalic arteries, which is shown here. Then you have the left common carotid towards the top head and neck, and you have your left subclavian artery over here. The brachiocephalic then divides into right subclavian and so on. But one thing as a student I've always wondered is, since these for example, let's take the example of the aorta itself. It has 3 valves coming off it. So technically it has its own valve coming off it, which then goes down into your abdomen, which is like the main aorta, abdominal aorta, and then on the top it has 3 different branches coming off it, brachiocephalic. How does it exactly share out the blood? This question's always been circulating in my head. Unless there's some sort of percentage that goes into the brachiocephalic, 25 goes into left common carotid, and another 25% of the blood goes into left subclavian artery, and the rest 25 goes down to abdominal. I'm not exactly sure of how that works, but I think that's all up to nature and how those all things work. If anyone does have an answer to that question, please do leave the comment below in the video, and I'll look forward to hearing from you, because I've always wondered about that question and really never found an answer for it. So one thing, we did forget the coronary artery. So here on the red blood vessels that surround the heart itself, these are known as a coronary. Anything that's red is coronary arteries, and the blue ones are known as coronary veins. So you have the main one here, which is known as a left coronary artery, right here, and then it splits into the circumflex artery, which then goes below to the left ventricle. This also then splits into different ones. You got the anterior intraventricular artery right here. So the main one you want to be aware of is the LAD, left coronary artery, splits down into the circumflex artery, which then goes down to the anterior interventricular artery. You also have the right coronary artery over here. So if this is the left, because this side of the heart is the left atrium, the coronary artery that's closest to the left atrium is known as the left coronary artery, and the one that's closest to the right atrium you can refer them to as the right coronary artery. And those as branches coming off it. The branches, for example, are, you've got the marginal artery coming here supplying the right ventricle, and yeah, so those are the ones that you need to be really aware of. But as a student, you wouldn't need to know it in a very great detail, because those are things that cardiothoracic surgeons and people who are really into surgery of the heart is really meant to know and be careful about. So external heart, major vessels of the heart. Vessels returning blood to the heart include, pulmonary veins, vena cava, stuff. We've gone through this. Right. So here is another external heart, the posterior view. See, on the top itself, you have the aorta. You have the superior vena cava over here. In terms of this, you have the right pulmonary artery, and you have the left pulmonary arteries here. This is known as the inferior vena cava, and so that drains straight into the into the right atrium, and that one drains into the right atrium as well. Then that goes around to the right ventricle over here, which then pushes the blood out through the right pulmonary vein out through here. Now over here, what we have is the pulmonary artery brings in, left pulmonary artery brings in blood into the left atrium, which then goes down into the left ventricle, which is then pumped across through the aorta. Okay, so that hopefully that makes much more sense now. And you have what's known as the great cardiac vein over here, the big one, and then you have the coronary sinus, which is this bulging part here. You have the branch that's coming off it, which is known as a posterior vein or left ventricle vein. You have the middle cardiac vein right here, as well as that you have the posterior interventricular artery. So you have the anterior interventricular artery as well as the posterior. So gross anatomy of the frontal section. So now you're just looking into a bit more detail of what's inside the heart. So far we've established all the different vessels and stuff, but we haven't gone through the main bits since within the heart. So here in the middle, you have the interventricular septum, and this is the myocardium right here where my mouse is outlining. You have the papillary muscles, which attaches the the valves are attached to. You also have the coordinate tendae, which are these they're like tendons basically that the valves are attached to. That the valves are attached via the coordinate tendae, which is attached to the papillary muscles. And then you got the tubercular carni over here, these little grooves. This is the fossa ovalis. This doesn't really have a function, but it did have a function when you were in your infant stages during fetal circulation. It had a role within the fetal circulation, but it's closed up. This is the pulmonary trunk and the valve, pulmonary semilunar valve of the left ventricle. You have the tricuspid valve, which is part of the right ventricle, and you have the bicuspid. Sometimes it's very hard to remember both of them, tri and bicuspid. I always get them mixed up, so I just call them left atrioventricular valve and right atrioventricular valve. It's much more easy because that way you'll never go wrong. The pectinate muscles on the side over here, and the rest are basically self-explanatory, I guess. So that's what the inside of the heart really looks like. And when you have, some sort of infection or some sort of, bacteria or anything that goes in through here, and they lodge into the heart, those kind of things can cause the inflammation of the heart, which then leads to serious problem. Inevitably, they all decrease cardiac output, and when cardiac output decreases, your heart starts beating pressure, blood pressure increases, and in the case of you having high blood pressure, there can be some sort of thrombosis, or other sort of causes and detrimental to your health, which are detrimental to your health particularly. But fetal problems, fetal conditions usually include things like ASD, when atrial septal defect, when kids are born or babies are born without this septum, so there is no separation between the right and left atrium, and those kind of things can cause really, pathologically can cause very different clinical systems, which can put the life of the patient in danger. Now, atria are receiving chambers of the heart, we know that. Each atrium has a protruding auricle, and the pectinate muscles mark the atrial walls. Blood enters the right atrium from superior and inferior vena cava and the coronary sinus. Right, so that's an important thing you need to remember. Blood enters the right atria, so the right atrium, from superior, inferior vena cava, as well as the coronary sinus. So the coronary sinus is the blood. It drains the blood from the basically the deoxygenated blood from the heart itself into the right ventricle. Blood enters atria from pulmonary veins. So the ventricles are the discharging chambers of the heart. Papillary muscles and tubercular carne muscles mark ventricular walls. So in terms of talking about muscles, when you talk about the atrium, we saw in the previous slide, if we go back, is the pectinate muscles that mark or form the atrial walls. But in terms of the ventricular walls, it's the papillary muscles or the tubercular carne muscles, so those groove-like muscles shown here, which forms ventricles. And the left ventricle pumps blood into the aorta. So just to clear up confusion, when I used to study these things by myself, or with your friends and things, always some sort of confusion came up. If the right atrium drains blood, only it drains blood from the right superior and inferior vena cava, as well as the coronary sinus, and then it pumps it into that atrium then pumps the blood into the right ventricle, which then pumps it out towards the pulmonary trunk, which then pulmonary trunk splits into left and right, so they take it to the lungs. People always used to get me confused by saying, what's the function of a right pulmonary vein? Well, the right pulmonary vein is simply, I know it sounds a bit real cliche, because most of you that's watching this video probably would be aware of it. I'll be a bit worried if you're not aware of what I'm about to say. It might sound stupid, but I always used to get confused. The pulmonary veins, the right and left, basically simply means they bring back blood from the lungs, so oxygenated blood into the heart, from the right pulmonary vein meaning right lung, left meaning left lung. So, key points here: the muscles that form the ventricle are the papillary and the tubercular. The right ventricle pumps blood into the pulmonary trunk, whereas the left ventricle pumps it into the aorta. So, myocardial thickness and function. Thickness of the myocardium varies according to the function of the chamber. Well, in terms of from A-level biology or GCSEs or whatever you studied, if you're from a different country, you would always know the left atrium has a thicker myocardium, so thicker muscle mass compared to the right atrium, because the left atrium pumps blood towards the extremities of the body. So the pressure and the force that needs to be generated from that muscle has to be significantly greater compared to the one from the right, because the one on the right, you're already pushing blood towards the lung, which is posteriorly not that far from your from the location of your heart, whereas pushing blood all the way to the lower extremities of your lower limbs, all the way down to your feet and stuff, can be very far. At the same time, you have forces against you like gravity and things, and that's hence the reason why you have a much more greater muscle mass on the left atrium. The atria thin wall deliver blood to adjacent ventricles. Ventricle walls are much thicker and stronger. So in general, things you need to be aware of is ventricle walls are much thicker than atrial walls. And then in terms of ventricle walls, the left ventricle is the thickest to supply systemic circulation. The right ventricle only supplies is less thick. It's not very thin. When I mean it's less thick, it's only marginally less thicker compared to the left ventricle, because it doesn't have to push blood to a very far distance, so there's little flow resistance, whereas with the left ventricle there's a higher resistance. Now, thickness of the cardiac wall. As you can see on the screen here, in terms of, if you look at the mass of muscle or the myocardium around the left ventricle here, and you can see the right ventricle. So this is a CT scan, or this is how CT scans would look, but not colourful, will be black. This is like a cross section where you've sliced it across, as shown in the image there. You can clearly see the myocardium of the left ventricle is much thicker than the right one. So the right is here, so look at the dia of that, whereas compared to the diameter of that. And I was talking about atrial septal defect, ASD, and things a bit earlier, is when you don't have a septum or something like that, where blood is able to cross, or deoxygenated blood can cross over to the left atrium, which can be very dangerous, and oxygenated can cross over to the right, and it all gets completely mixed up, because sometimes these bloods mix together, they have different electrolyte, different electric balances, charges, and in terms of biochemistry, they have different properties. And if these get around, so if in the case of blue deoxygenated blood going to the left atrium, which is then pumped around to the body, you're basically supplying your muscles which are respiring, which need oxygenated blood, with deoxygenated blood, so they won't be, they'll be fatigued much more quickly. They won't be having a nutritional supply. There'll be, the necrosis of, how do you say? There'll be a lack of oxygenated blood supply, and that can be detrimental to babies, especially. And this takes place in a fetal stage. And sometimes you have this syndrome called blue babies, where the baby looks to be very tender, pale blue, and sometimes this is the issue. You also have ventricular septal defect. So this time the septum between the ventricles are missing. The ASD is the septum between the atrium are missing. At the end of the day, both are very dangerous, and surgical procedures are the only way to get them sorted out. So, pathways of blood through the heart and the lungs, which should be commonly simple to you if you're watching a video like this. The right atrium obviously is tricuspid, or in the words of me, I like to say right atrioventricular valve. That pushes the valve open into the right ventricle. Then the right ventricle pushes the blood through the semilunar valves into the pulmonary arteries, and then off into the lungs. The lungs push the blood through the pulmonary veins into the left atrium. The left atrium then pushes it through the bicuspid, or the left atrioventricular valve, into the left ventricles, which then is pushed through the aortic semilunar valves. So you have the aortic semilunar valves as well as the pulmonary semilunar valves, so don't get it completely mixed up, and then into the systemic circulation. So this is just a simple pathway of what I had just defined or explained to you. So if you just take a moment to go through it. Alright, so coronary circulation is the functional blood supply to the heart muscle itself. So coronary circulation are looking at the coronary valves, And the collateral routes ensure blood delivery to the heart even if major vessels are occluded. Occluded means, they're blocked by some sort of fatty deposits or atheroma or some sort of plaque. Occlusion. So you have, there's always a backup reserve method in order for blood to get to the heart. So that's known as the collateral routes. So coronary circulation and artery supply. So as I said before, you first, if you're learning the anatomy and you're trying to learn these vessels and you're trying to name them, the first and most thing that you want to do is you want to always indicate where the left atrium is, and just below the left atrium you would have the main one, which is known as, over here you can see it's slightly pinkish color because it's behind the left pulmonary vein. Over here is the left coronary artery. The left coronary artery then branches off, so you can start at the left coronary artery always, and then you can branch off to the left circumflex artery over here, and then you got the main one, right, which is known as the anterior interventricular artery, which is pretty much the main one you need to know, right? So in terms of so always start off by labeling, find the left atrium, and then next to the left atrium, before it branches off, indicate or locate the left coronary artery. Then it branches off into the circumflex artery, and as well as the anterior interventricular artery, or known as left anterior descending artery, LAD, which is what I refer it to as. It depends on your fashion and your type of learning. Right, now the ones that's highlighted in bright red are the ones anterior in the front. The ones that's pinkish color, lightly redder, they're on the posterior side. So here you have the right coronary artery. So once you identify the left one, you can easily identify the right coronary artery, which is obviously next to the right atrium, and then that also has branches which goes down to the marginal artery over here. You have the circumflex artery, which goes around like this and then comes around, and this over here is a junctional vessel known as anastomosis, and then the circumflex artery splits over into posterior interventricular artery. So you got the PAD and the LAD, or in a sense you can say RAD, because that does supply the right ventricles, whereas this supplies the left. So hopefully that makes it much more easier to learn the coronary circulation. So always, number one, left coronary artery, the circumflex artery splits off it, and you got the LAD, or the anterior interventricular artery. Then you have the circumflex artery, which splits into the posterior interventricular artery. You have the right coronary artery over here, which splits into marginal artery, and so on. Now, in terms of naming the coronary circulation and the venous supply, so the veins of the heart, you always want to start again. You want to start off with the left atrium, so somewhere here, the auricle of the left atrium. You want to identify the first main blood vessel, which is known as the great cardiac vein. Then you want to follow it down, the main one that you see in the front, in conjunction. So this follows a similar route, if you remember, to the LAD, or the anterior interventricular artery. So this is known as the great cardiac vein. Then you can come across and basically see what's the next major one. Is probably somewhere on the bottom here. That's known as the small cardiac vein. In terms of the main, if you rotate this posteriorly and you see a very large bundle or a very large thick coronary vein, and that's referred to as a coronary sinus, and this drains into the right ventricle. Then you have the middle cardiac vein coming off the coronary sinus, as well as a small cardiac vein which does come off the cardiac coronary sinus, but it's anterior, whereas the middle cardiac vein is posterior, so it supplies the back of the heart. Okay, so heart valves, what they're there for. The heart valves, ensure unidirectional blood flow through the heart. The atrioventricular valves lie between the atria and the ventricles. So the AV valves lie between the atria and the ventricles, and they prevent backflow into the atria when ventricles contract. The coordinate tendonae anchor the AV valves to papillary muscles, which is what I was trying to bring across to you guys before when I was talking about the coordinate tendonae compared to the papillary muscles. So if you were to go back, so you got the coordinate tendonae over here, and you have the papillary muscles over here. So and this right here is a tricuspid valve. So you can see the tricuspid valve. Imagine it as a muscled tendon, tendon, same thing. So the valve is connected to the papillary muscles via the coordinate tendonae. Now you have semilunar valves. You got the aortic semilunar valves with pulmonary semilunar valve. Their function is to prevent backflow. So this is the anatomy, or how the heart valves look. And over here, there's the anterior view. You can clearly see this and this one here. This is the tricuspid valve, and this is the bicuspid. So tricuspid meaning right, it goes towards the right ventricle, and the bi meaning it goes towards the left ventricle. You can also call them the mitral valve, but it's much easier to name it how I name it: right atrioventricular and left atrioventricular. You got the aortic semilunar valve here, and you got the pulmonary semilunar valve. Alright, so just take a time to familiarize yourself with these different pictures. Again, this is something that I was gone through in the previous slide. So moving forward, atrioventricular valve function, I'm not really going to talk about this because this is self-explanatory. If you do need time to understand it and you don't know, you can pause the video now and read through this slides itself, because I'm not going to waste my time going through this. It's fairly self-explanatory. Right, the microscopic anatomy of the heart muscle. This is when you need to know this pretty much off by heart, because these type of questions always come up in the MCQs or the in your exams, and this is basically the histology, where you really histological or the more microscopic anatomy of the heart muscle. So the cardiac muscle is obviously striated, short, fat, branched, and interconnected. So they have intercalated disc basically. And the connective tissue, known as the endomysium, acts as both tendon and insertion. The intercalated disc anchor cardiac cells together and allow free passage of ions. So therefore, it's almost as a wave of action potential can literally move through. Heart muscles behave as a functional syncytium, so they behave together, or they support each other and act together. It's almost so it's in a cohesive manner. So here is the microscopic anatomy of the heart muscle. So in case you get an image like this, an histological image like this, and they can always ask you a question: what does this image refer to? What type of muscle it is? You want to always look for the intercalated discs. So these are these lines here. They connect basically one muscle to the other, allowing passage of ions freely through them. And you've got the different bands. So the intercalated disc, as you can see here, which are connected by desmosome, mesosomes. These are gap junctions and tight junctions, which if you do when you first learn about the cell, you will go into it in a bit more detail when you learn the cell biology of the medical medicine. And it's these desmosomes and tight junctions and everything that you regulate with drugs. And yeah, so you have striated intercalated disc muscles, as shown shown in the thing, shown in the slide. So I guess that sums up the anatomy of the heart muscle. If you do have any questions, or if you feel as if I haven't explained it thoroughly enough, you can always leave a comment below. And you should always subscribe to our channel, Royal Christ College. And if you want to take part in making videos like these, or you have another better idea where you want to make videos of doing OSCE practicals for other fellow medics, dentists out there, you can always do so. Just get in contact with me, send me a message, or you can visit our website at www.royalchristcollege.co.uk, and then from there you can follow the instructions on how to submit your work and become a member of our team. You don't really have to pay. There's no pay fee for becoming a member, and it always looks good on your CV when you're applying to hospitals for foundation year placements as well as internships. Yep. So that sums up the cardiovascular anatomy. If you do have any questions, please do mention it in the comment. Also suggest how I can improve my videos in case if I need to add more content, or do I need to speak less, make my voice clearer. And on behalf of RCC, and on behalf of myself, Matthew Jose, I'd like to say thank you to everyone who's taken their time to watch this, and hopefully has helped you learn something new and helped you in your exams. So thank you.